afternoon. Thank you very much, Dr. Stamelou and Dr. Siderowf, for accepting this invitation for the interview for Moving Along newsletter. So we are very excited because MDS Congress is coming and it's going to take place in Philadelphia this year. So Dr. Stamelou, can you tell us more about the scientific program? Is it already developed? Is it decided who and which sessions are going to take place?
As a CSPC chair, together with my co-chair, Andrew Siderowf, we're very happy to share with you a glimpse into what we hope will be an exciting, educative, and innovative program. So first, the theme of the Congress, which we feel is timely and relevant: artificial intelligence in movement disorders, how to harness AI to improve patients' lives. We have designed sessions that emphasize how AI advancements are transforming research, diagnostics, personalized treatment plans, and patient care in general in movement disorders. In this regard, the collaboration between AI experts and movement disorders experts we think is crucial. So we have invited an honor to have a keynote speaker from this field, Professor Dina Katabi from MIT. So we're really looking forward to her lecture and also to the discussions following this lecture on these issues. Because of this emergence of AI, we felt that having educative sessions on human-centered qualities, so human intelligence of clinicians, are more urgent than ever. So we will have sessions on how to enhance interpersonal skills, how to communicate with patients, how to deliver difficult news and difficult diagnoses, how to cultivate empathy, and how to be able to understand and take into account patients' perspectives when planning treatments. The second new thing is the breakthroughs plenary session, which will follow the keynote plenary. So the program is being developed actually a year in advance of the Congress. So everything important, like let's say results from a clinical trial that come out after that, will have now a visible and broad platform to be presented and to be discussed by a panel of experts. Of course, we will provide, as every year, state-of-the-art treatment of movement disorders, always with an emphasis on a holistic and personalized approach to patients' care. There will be many translational sessions to bridge the gap between scientific research and clinical applications, and to ensure that scientific knowledge is effectively translated into patients' care. So we'll have teaching courses, skill workshops, video sessions, which will be mostly dedicated on phenomenology and clinical practice tips, and will be for every level of education. So for junior colleagues that are just starting to movement disorders experts. And of course, in the clinical sessions, but also in dedicated sessions, the multidisciplinary aspect of treating patients by a close and constant collaboration with allied health professionals will be highlighted. There will be sessions that are dedicated to inclusivity and diversity in research and in clinical aspects of movement disorders. So the audience can expect to see a global perspective of all what is happening in movement disorders from research to clinic, which has been actually identified and recognized finally as a very important element of moving our field forward. And all that will be presented by, and we are very proud of that, by an amazing faculty of world-leading experts in the field from all over the world, while there will be at the same time many opportunities for younger colleagues to present their work.
Wow, it sounds amazing and fantastic. So I wonder what can Dr. Siderowf add, because I know that your role in this Congress is particular, right? Because you are one of the local organizers, local hosts. So what is your impression? What are you looking forward with the upcoming Congress?
So a couple of things. We're looking forward to showcasing our city, Philadelphia. For a North American city, it's steeped in history, and we're really looking forward to showing that off. But Philadelphia is more than just Ben Franklin and cheesesteaks and now Jason Kelsey. there's a lot to do here. There's great colonial history, as I mentioned before. There's wonderful food, terrific museums. I think that we're going to have an event at the Barnes Foundation, which has a world-class collection of Impressionist and Post-Impressionist art. There's a wonderful parks in the city. Fairmount Park, designed by Frederick Law Olmsted, a famous landscape architect in America. It's a treasure. There's a great orchestra. There are sports, and this should be right at the height of the baseball season when the meeting occurs next year. So really, in short, there's something for everyone in Philadelphia, and the convention center where the meeting is going to be held is really centrally located. You can walk to restaurants. It's very close to public transportation where you can get down to see sports. You can walk to the orchestra. So I hope people will go to the meeting for sure, because it's going to be great. But I also hope they get out and see our city a little bit. One other thing that I've been involved in because of the local nature of my role is I'm finding patients for the Grand Round session. And we've already started looking for patients that we think are going to be challenging for the experts, but also educational and demonstrate important teaching points that the audience, including trainees and experienced clinicians alike, will be able to watch the experts who are conducting the Grand Rounds exam histories and examinations, can see how they go about it, what their thought process is, and hopefully the audience will be able to take home from the patients we bring and the experts who come to examine them things that they can use in practice and will improve their expertise as movement disorders clinicians. Where the Grand Rounds is meant to sort of be something that you can take home, and the video challenge is a little different because it really is meant to show off the expertise of the people who are involved in it, and show challenging cases, and show how there's really some tremendous experts among us, and I think we'll all learn something from them.
Yes, that's true. And I think that the video challenge is something that we all always look forward, right? Because it's so excited, and the experts are always amazing. So it's great to see very interesting cases from all over the world. Okay, so thank you very much for your time. It was a pleasure to have you here.